Hey everyone, I'm Dr. Jason Moyer, and I need heart surgery. In less than 1 week from recording this video, I will be having heart surgery. And the reason why I'm making this video is to document what all goes on before a procedure and then after the procedure. And before I go into exactly what kind of procedure I'm having next week, I need to explain exactly how I got to this point in the first place. I was born with a congenital heart defect that's pretty complex but surprisingly common. It's called tetralogy of Fallot. And if you aren't familiar with tetralogy of Fallot, this animation should help you out. So in order to understand the individual elements of tetralogy of Fallot, it's important to understand how normal blood flow should look in a human heart. Okay, here we have a illustration of the heart and the lungs. Some common landmarks are identified here. So this is how blood flow should normally work. And on this illustration, the color blue indicates blood that does not have oxygen, and blood that does have oxygen is red in color. So the right side of the heart has blood that is deoxygenated. It will pump blood to the lungs so it can pick up oxygen that come back to the heart on the left-hand side to be pumped to the rest of the body. But unfortunately, that's not how it works with a heart that has a tetralogy of Fallot. And just like the name indicates, tetralogy, the prefix tetra indicates 4. And there are 4 issues going on at the same time in this condition. And those 4 are indicated here on this animation. We'll start with this one first. There is a much thicker than normal right ventricular wall. And when the muscle gets that thick, the pumping of the right ventricle becomes very inefficient. So it can't pump blood well enough to the lungs. So that's one issue. Another issue is this, a stenosis or a narrowing of the pulmonary valve. This will also lead to a restriction of blood flow being sent to the lung. So it's going to make it even more difficult to pump blood from the right side of the heart to the lungs. Another issue you have is here, the overriding aorta. And what that means is the aorta is a lot more anterior than it should be. So it's basically pressing down on the pulmonary trunk, also restricting blood flow. And our last issue is here, a VSD, a ventricular septal defect. This is basically a hole in between the right ventricle and the left ventricle. So what that means is you have blood that does have oxygen in the left ventricle mixing with blood that does not have oxygen in the right ventricle. And it's that blood now getting pumped out to the body. And all 4 of these issues all result in an ineffective delivery of oxygenated blood to the body's tissues. So you can see when the animation is turned on how different the blood flow is internally in a heart with tetralogy of Fallot, especially how the blood mixes here, blood with oxygen and blood without oxygen. And that's the blood that is getting pumped out to the patient's tissues. And this is why patients with tetralogy of Fallot will often become hypoxic, because their blood does not have the oxygen that their cells need in order to function properly. So this condition has to be repaired with open heart surgery. And I had this condition repaired with open heart surgery when I was about 18 months old. However, there was a problem with that surgery. The problem was, with that surgery, my internal conduction system of the heart got damaged. And ever since then, my heart does not beat enough on its own in order for me to survive. So ever since then, I've been fully dependent on a pacemaker. So I got my first pacemaker when I was 2 years old, and I've had them ever since, and I will continue to need them for the rest of my life. So pacemakers have to be replaced every so often. A typical pacemaker will last between 7 to 8 years, but of course that's going to vary on the battery's settings. Now, I am no stranger to having heart surgeries. I'm no stranger to being in a hospital. I'm actually quite comfortable with it. At this point in my life, I've had 14 or 15 surgeries, including 2 open heart procedures. And the device I have currently is my 8th device. And that may seem pretty high, but the problem was my first few devices kept getting infected within the first year. So here's an older device that I used to have.
This was my old pacemaker from about 10 years ago, and they allowed me to keep it, which I've always found very interesting to have. Now, this is just a typical pacemaker from Medtronic. The device that I have currently is not a pacemaker, it is an ICD, implantable cardioverter defibrillator. It functions as both a pacemaker and a defibrillator if needed. And that's the procedure that I'm having next week. I'm having the ICD generator replaced. So essentially, I'm taking out a device that is very low on battery power and putting in a device that's very high in battery power. Because as of recording this video, I only have about 4 weeks or so of battery life left. And if that battery life runs out and the device is not replaced, then I can't survive. So as you can imagine, it's pretty important to get this replaced. So before I have the procedure done next week, there are a few things I need to take care of first. I need to have some blood work done, I need to have a chest x-ray, and I need to have a test for a virus that I can't say here on YouTube. But let's say it starts with the letter C and ends with the number 19. And I think we all know what I'm talking about. So I will take care of all 3 of those on the same day. It'll be about 5 days for the procedure. So I will check in with the video on that day. All right, it is 5 days before my procedure to replace my ICD. There are a few things I need to take care of first. So today I'm getting a chest x-ray, I'm getting some blood work done, and I'm also getting a COVID-19 test. So thankfully, 2 of those 3, the chest x-ray and the blood work, will be done here at the same location. And the place I have to go to for my COVID test is only about a mile or so away from here. So I probably won't film when I'm inside getting the chest x-ray and getting the blood work done. I don't want to violate anyone else's privacy. It's there waiting on their own test. So I will check back in when I get done with both of those. Alright, I'm now leaving the clinic. Just had my chest x-ray and some blood work done. Overall, the place was fairly busy, which was not a surprise, considering it is a clinic associated with the hospital. So even though it was pretty crowded, I got through pretty quickly. I got both the blood work done and the chest x-ray done in about 35-40 minutes. So the next thing I have to do is my COVID test. That is not scheduled till 1 o'clock. It is now 11:15 a.m. So I have just under 2 hours before I have to go get that test done. So what I think I'll do is I'll go grab some lunch first, and then I'll go get the COVID test. Alright, I just got here to the clinic for my test. As you can see, it's a drive-up clinic. So you just pull in, and then they come out to your car and administer the test. Then they have the results in about 15 minutes. They're currently closed for lunch, but people are starting to line up now. But they should be opening here in about 5 or 10 minutes. Alright, I'm about to get in line to get my COVID test done. When I get the test performed, I'm not going to have that on camera for one reason. Whenever I get this kind of test done, my eyes get really, really watery, and then I start to laugh uncontrollably, which makes my eyes water even more, so I end up looking like a big idiot. So I'm not going to put that on camera here for the video, but I will check in after I get my official results from the test. Alright, I just got done with the COVID test, and it actually wasn't the test I was expecting. I was expecting the nasal swab, which I was not looking forward to. But this test was actually the one where they swab the back of your throat. So it was a lot faster, a lot less uncomfortable. So it's definitely my preference when getting a COVID test, is getting the throat swab as opposed to the nasal swab. So I'll get my results in about 24 to 48 hours. And then fingers crossed they come back negative. And then if it's negative, then the procedure will be, we'll go ahead as scheduled. But if it is positive, then we'll have to delay the procedure, which I really can't afford to do because I only have a few weeks of battery life left on my ICD. Hopefully it'll come back negative. I have no reason to believe why it wouldn't be negative, but I will update you as soon as I get the results. Okay, it is 1 day before my surgery. I just got a call from the hospital earlier this afternoon, and we are a go for tomorrow morning. The surgery will start about 7:45 a.m., but they want me there to be checked in at 6:15 a.m. And I live about 25 minutes away from the hospital, so it's going to be a pretty early and fairly long day tomorrow. And I actually prefer early morning procedures. That way there's a less chance that your procedure gets delayed, and also it's more time for you to recover at the hospital. So assuming there's no complications from my procedure, there's a good chance I'll be able to come home tomorrow afternoon. Now there are still a few things I need to take care of before my procedure. One of them is after midnight tonight I will be NPO, which means I cannot eat anything until I recover from my surgery. I'll be able to drink clear liquids, but I try to limit that as much as I possibly can. What I will do is I'll have a late dinner, later than normal, something heavy, that way I can go to bed early, or at least try to go to bed early, because you can't be hungry if you're asleep. There are 2 medications that I have to use before I go to bed tonight, and one of them is this. This is Hibiclens. This is used to prevent skin infections. So before I go to bed tonight, I will take a shower, and then when I'm done getting cleaned off, I will use half of this bottle on the area that I'm going to have the procedure on, which will be right here underneath my right clavicle. So I'll use half this bottle on my upper chest and then rinse that off. And also before I go to bed, I will be using this antibiotic ointment, mupirocin. And I've never used this before, so this should be pretty interesting. The way you use this is you put a pea-sized dose on a Q-tip and you rub it on the inside of each nostril and then you massage it in. And this is used to prevent staph infections, especially MRSA. So tomorrow morning, before I leave for the hospital, I need to use both mupirocin and Hibiclens again. So I need to take another shower in the morning, use the other half of this bottle. Then I need to have another application of the mupirocin inside my nose. And I may put that on camera for the video, we will see. All right, so I will add the next segment of this video early tomorrow morning after I get ready. So I will see you then. All right, morning everyone. It is day of the surgery. It is just after 5 a.m. Didn't really sleep well last night, only got a few hours sleep. So I've been up since about 4:30. Went ahead and had my shower already, using the rest of the Hibiclens. I'll use the rest of the antibiotic ointment here in a second, so you can see how it looks when it gets applied. So it's now where things start to get more real for me anyway, because I know in a few hours I will be at the hospital and then laying on a table and having the device that keeps me alive taken out of my body and then a new one put back in. So it's something that I tend to not think about too much. I've never gotten scared though at these procedures, mainly because I've grown up with it so much. I've been having these operations since I was 18 months old, so I'm very comfortable around these procedures. Never really bothered me. That's why I've never gotten too freaked out over it. I still do get a little bit nervous though, which is a normal reaction. So I'll tend to get a little bit more nervous when I get actually in the operating room a little bit later this morning. I'm not sure how much I'm going to be able to record while I'm at the hospital, mainly because I don't want to interfere with the medical staff of them doing their jobs. So if I do record anything, it may be a short clip after I'm already prepped, with the gown on, with the IV in. If I can't do that, I may just take a few still pictures with my phone before the procedure, then after the procedure, so you can see a difference there. And I can guarantee I'm going to look a lot rougher after the procedure compared to before the procedure. So I will record something after I wake up from the anesthetic, whenever I am somewhat clear-headed and able to record a coherent video. My voice will be strained, my throat will be sore, mainly because I will be intubated during the procedure, which is pretty standard, so that is to be expected. So before we go, I want to show you this mupirocin ointment and how you apply it. Again, you just put a little bit, about a pea-sized dab, and you rub it inside of your nose. And again on the other side. And then you just massage it in. And it feels just as weird this morning as it did last night. So, not a bad feeling, it's just very, very, very weird. So, alright, it's about time to get ready to leave. So I will see you at the hospital. So, let's do this. Alright, hey everyone. It's a little bit after 12 p.m. Surgery went fine. overall feel really good, just a little bit sore, a little bit tired. But I'll be able to be discharged here in about 30 minutes, so I'll be heading home here soon. So I'll record something a little bit more detailed a little bit later. Hey everyone, I'm finally out of the hospital and I am back home. Overall, I feel fairly good. I'm tired and sore, but that's to be expected. And everything today went really, really well. I was very pleasantly surprised with how smoothly everything went. I got to the hospital about 6:15 this morning. I got registered, I got checked in, I got this wristband that I still haven't cut off for some reason. I got escorted to a room where I could get changed. Got changed into the gown. I got the IV started. I got my chest shaved. Talked to a lot of nurses. I talked to the anesthesiologist. Talked to the doctor. And everything went really well. Procedure started a little bit later than normal. It got started a little bit after 8 a.m. But it only took about an hour and a half. And some things that happened that I was very surprised about. One, I was not fully anesthetized, and two, I was not intubated during the procedure. So because of both of those, I didn't wake up feeling nowhere near as groggy as I normally would, and my throat wasn't sore because I wasn't intubated. So I woke up from the anesthetic about a little bit before noon. They gave me lunch, which was pretty good. I'm sure because I was really hungry, helped make it seem probably better than it was. I met with the doctor again afterwards, and then I left the hospital about 1:30 p.m. and then I was home by 2 p.m. And then when I got home, I did what I always do after any procedure. I got something to eat and I took a nap. So even though the procedure is over with, there's still some things that I need to take care of. In the morning, I'm going to be picking up some medications I need to start taking. One is a antibiotic. It's a clindamycin to help prevent post-operative infections. And another one is a probiotic, which helps to mitigate the side effects of the clindamycin. And it has the bacterium lactobacillus inside it. So I'll take both of those for a little bit of time up until my follow-up appointment with my doctor next week. And the biggest thing I need to take care of between now and next week is wound care. And you can't tell because I'm still wearing the shirt, but over the incision site right here is a fairly large and bulky dressing, which kind of restricts the movement of my arm, which is to be expected. You don't want the arm to be moving too much. And even though you can't see it, I will include a picture of how it looks here now. I'll be able to take off this dressing tomorrow morning, and that will leave the incision site exposed with the skin glue on it, that Dermabond glue to help keep the incision closed. Now with the incision being uncovered like that, I can't get it wet for 1 week. So that means I can't take a shower. I can take a bath, but I can't take a shower. So that means I have to wash my hair in the sink until that week passes. So it's inconvenient, but it's not the end of the world. And then after that week passes, after I meet up with my doctor and I get the okay from him, I will be able to take a shower after that. But I can't let the water from the shower directly hit the incision site because that will slow down the healing process. Plus, it is just really, really uncomfortable. Because I've made that mistake before in the past, and trust me, it hurts like hell. So you really don't want to have water from the shower hitting the incision site. So what you do is you have your back toward the shower and let the water run over the incision site, and then pat it dry when you get out of the shower. So the last segment of this video will be me going to the doctor for the 1 week checkup after the procedure. So I will check in with you after that next week. All right, morning everyone. It is now 6 days after my procedure. I'm here at my doctor's office for the customary 1 week follow-up. The main goal for today's appointment is to check the incision site. Make sure there's no infection, and make sure that it's healing properly. I don't expect this appointment to be that long at all. I will probably spend more time on the road driving back home, which is about 25 minutes, than I will here at my doctor's office. So far, the recovery has been going pretty well. I took off the big dressing that you saw in the picture a little bit ago, the day after the surgery, which was a challenge. It didn't hurt, but it certainly did not tickle. So it was an adventure to take that off. And so far I've only had 2 real issues with the recovery. One is the itching. As the incision site heals, it's getting more and more itchy, which means it's healing, which is good. And also the hair that was shaved off before the procedure is now starting to come back, which is now starting to get very irritating. So that's one issue. And probably the only real issue I've had since the procedure has been sleeping at night, especially the first few days after the procedure. With all the swelling and the tenderness, it was really difficult to get comfortable at night and to get a good night's sleep. As the swelling goes down and as the discomfort goes away, that will become more easier day by day. And the swelling has gotten a lot better since I first got home, 6 days ago. So I expect that to take care of itself within the next week or so. All right, so I will check in when I get out of my doctor's office. All right, I just got back from my doctor's appointment. As expected, it was a very short appointment. It only lasted maybe 10 minutes. The incision site is doing okay. There is some inflammation. The nurses think that it's probably due to the Dermabond skin glue that's holding the incision together, but that should go away within the next few days. So everything is good. I'm now cleared to take showers again, which is really good. So I'll probably do that shortly after I get home. So there's one more thing I wanted to show regarding this journey with my ICD replacement, and I'll show you that when I get back home here in a little while. Alright, I'm now back at home, and the last thing I wanted to show you in this video is how my new ICD was going to be monitored by my doctor. With my old device, I would send regular EKGs over the phone to my doctor in his office with this device. This is from Medtronic. What you would do is you would take this part of it, you would put it over the device, and it would collect data and send it wirelessly through my Wi-Fi connection to my doctor's office. But with my new ICD, I will now use this device. And this one will work a little bit differently. This one will stay plugged in 24 hours a day constantly by my bedside. And it will monitor my device whenever I am near it. So it will collect data all the time. And I can use this part of it for regularly scheduled EKGs to my doctor's office. Alright, that takes us to the end of this video of me documenting my journey with getting my ICD replaced. If you've made it to the end of this video, I appreciate you taking the time to watch it. I know this is a longer video, but if you have any questions about the new device that I received, about my recovery, or about anything in general, just please let me know in the comments down below, and I will answer them as best as I can. Thank you for watching.